So I think a lot of the problem has been that we've lived in a model that's 30 years old, that I can just take care of the sick people that come to our health system. And that will make us irrelevant because all of the dollars are being spent on getting people out of your health system, right? So I think, Upton Sinclair said it's hard to get somebody to do something when their salary depends upon them not doing it. So what health systems have to become is really the community's health. So at Jefferson, I ran a $9 billion hospital system, but I didn't talk about our hospitals. I had a sign in my CEO's office that said, I hope 5 years from now, when Elon Musk brings people from Mars to Philadelphia and says, where's Jefferson? You can't define that. You mean Jefferson on my iPhone, or Jefferson in partnership, or Jefferson in our outpatient centers where we do the joints? Oh, you mean the place where really, really, really sick people go? I think that's still a tenth of walnut. I would argue that almost every health system here and around the country, we went from being hospital systems to health, but then we define ourselves by where we failed to keep people healthy. So how do you start to create creative partnerships with the folks that can do that in a way that also contributes to your bottom line? So I think one of the things that health systems haven't really taken advantage of is the billions and billions and billions of dollars that's going to be spent on digital health transformation, generative AI, et cetera. At General Catalyst, for example, we've created health assurance partners, 20 health systems that are working with us. So that gives them the opportunity to have first crack at the generative AI, LM, and also to invest in that. At Jefferson, we created what we call the old math and the new math. The old math was the academic and clinical and hospital pillar, which used to be our only math. The new math was innovation and strategic partnerships. So the difference is, I wasn't going to go to healthcare conferences anymore where all these people were displaying their new digital tool and have them tell me, I'm 28 years old, I'm going to solve healthcare. I'm going to say, if you're good enough for me to buy, I want to be a partner. So at Jefferson, we got to the point where we were really bringing as much to our balance sheet from our strategic partnerships with the General Catalysts of the world as we were from literally our more traditional math. So I think the key is really starting to think about who you're bringing in your C-suite. One of the most important people I brought into my C-suite was a CMSMIO, Chief Medical Social Media Information Officer. Now, we were the only large academic medical center that has CMSMIO. First of all, it's hard to say. But secondly, think about that. How many, especially younger people, are getting all their information from social media? And we had this guy, Austin Chang, who was a darling of TikTok, who was basically sitting in my cabinet, helping me understand both what people were hearing and making sure I was getting the message out. So I think those are the kind of things that health systems and boards have to think about that they didn't before. Well, I think there's a couple of things. I think, first of all, we have a turnover tsunami. We have a crisis in workforce. And that crisis in workforce gets down to a couple of things. We have basically assumed that nurses were just always going to be there, plentiful. And once the pandemic hit, and all of a sudden they were healthcare heroes, et cetera. But then after the pandemic, we didn't necessarily treat them like healthcare heroes. I was part of a Deloitte study where there was something like 45% of nurses don't think that their health system CEO cares about them. So while many of the people watching this who are health system CEOs or CHROs might say, oh, it really stinks. These nurses have gone over into temporary staffing. It's costing us $250 an hour. Well, it's because when you could, some of us really didn't act like we really cared about them. So I think the key to me is, how do your employees feel that you're helping them succeed? Are you upskilling them? If you're a young nurse or a young staffer and you want to advance, can I advance within your health system and you're going to help me get there? Are you giving me flexible models to work, or is it just the same old thing? And I think one of the really important things is, do you care about what I care about? So I had 45,000 employees. Among my younger employees, they wanted to know that I gave a darn about climate change and that I was acting on it. One of the things we did that was one of our best employee retention things was we changed our mission. Every academic medical center in Philly, and there's like 5 of them, the mission was, we want to be the premier academic medical center in Philadelphia. First of all, nobody cares about that other than you or your mother, you get a little trophy. But secondly is how's that defined? So we changed ours to we improve lives. I made 25% of my salary based on reducing 5 health inequities in Philadelphia. And we had younger employees saying, that's the kind of place I want to work for. So I think that the key now is to recognize that people want to go into healthcare and health to help people. And they want to know that their CEO has that same passion for helping people as they do. And if you do that, and you treat people fairly and you give them the right kind of incentives, I think you can really, really maintain and actually grow a very loyal employee base. Yeah, so when I got to Jefferson, I was sort of an unlikely academic medical center CEO. I was more of an entrepreneur. And my first faculty meeting was, we were a very conservative place, great academic medical center. And I said, tell me something exciting about Jefferson that would get people to want to really invest in us. And one of the faculty members raised their hand and said, well, we're number 2 to Penn, but we're better than Temple and Drexel. I said, A, that's like the opposite of exciting, and B, I have no idea if any of that's true, by what parameters. And then another faculty member raised their hand and said, if you give us more money for NIH funding and get us a proton for cancer, we can get closer to Penn and US News and World Report. And I remember saying, since this is on video, you'll understand this, I said, if that's what you brought me in here, it would be like if height and hair were the 2 most important criteria, I probably wouldn't have taken this job. So we came up with a model of what we called being a 195-year-old academic medical center, thinking like a startup company. And then what happened is we asked health systems to join us. We didn't acquire health systems. We basically brought health systems that wanted to get into that future of healthcare at any address and innovation. And we gave them equal board seats. We didn't acquire them, we didn't buy them. They were actually my bosses. So we did 7 mergers. And on the university side, we had been a 195-year-old health science university. I merged with the number 3 fashion design university in the country. People thought literally I'd gone off the deep end, and my wife had been the associate publisher of Vogue, so people thought I was bringing my personal life into my professional life. But actually, it was actually one of the things I'm most proud of, because we started talking about the design of the human experience in healthcare. We actually created an MD Masters in Design that was really, really successful, because healthcare starts at home. So I think the secret to Jefferson's success, and we did go from 2 hospitals to 18 hospitals, from a 3,500 health science university student to almost 10,000, broad university. We acquired an insurance company. The key was that we became really indispensable to the community. And that wasn't the typical 1990s leverage with insurers. It was that Jefferson was everywhere. Within 10 minutes of just about anybody, there was a Jefferson entity that could help. And frankly, we also took advantage of other people not changing. There's a quote I like to use. Jason Kidd, who was a point guard for many years, went to the Dallas Mavericks. They were 24-52. And his press conference, he said, I'm going to turn this team around 360 degrees. We do a lot of turning things around 360 degrees in healthcare. And Jefferson was like a place, this was back in 2013 when we were investing $35 million in telehealth, where people from Palo Alto were saying, there's this weird place in Philadelphia that gets it. So all of a sudden, we went from getting $25 million a year in philanthropy to $250 million a year in philanthropy, because we were thinking creatively. We were thinking more like Apple was thinking back in the early 2000s, making iPods, as opposed to Microsoft that was just figuring out how many hard drives they could add to Windows. So I think a lot of that was both thinking creatively, but then I think the other thing that's really important is the execution. I had a Wharton professor that used to say, you should always have 5 people under you that think they can do a better job than you and 3 that are right. So I hired really, really good finance people, human resource people, etc., that were going to make sure I didn't go too far off into the stratosphere, and we're making sure that we executed and maintained our A rating.